The reason is when you give someone, it's funny, I actually had this patient this week. She said, Dr. Rubin, I have hot flashes, I have night sweats, I'm miserable, but I'm using estrogen. And she was using her vaginal estrogen inserts. And we had labs for other reasons. We checked labs on her, and her estrogen was zero, right? She had zero estrogen in her body, but she said, but I'm using my vaginal inserts, 3 times a week. I'm doing what I'm supposed to be doing. I said, yeah. And that is fixing your vaginal and bladder symptoms, which were great. She was having no pain with sex. She was so happy. She has not had a UTI or a yeast infection or BV. She's so thrilled, but now she has all the other menopause symptoms. And so that's why, the vaginal hormones do not go through the whole body and do not increase estrogen levels. And so they really were not worried about breast cancer and stroke and heart attacks and dementia. Do we need more data and research? Of course we do. And so many breast cancer survivors are terrified of the word estrogen, but there is a difference between whole body estrogen and the minuscule doses of vaginal estrogen, right? So right there, if you were to give estrogen by mouth, you might give 2 milligrams per day, right? That's 2,000 micrograms, okay, right? 2 milligrams, if I do my math correctly, is 2,000 micrograms per day of estrogen. Vaginal estrogen is 10 micrograms twice a week, right? So 2,000 micrograms every day versus 10 micrograms twice a week, right? It's a big difference. It's a big difference.
Absolutely. Absolutely. And so I think, what would you say that you would want women to know? One thing